We need to change the healthcare landscape in this country, especially relating to pain. Handling pain responsibly. What does that mean? It means practicing and doing modalities that can actually heal the body. Your body was given by God, or whatever you believe in, the ability to heal and repair. And how do you enhance that? That's responsible pain management. Doing things that are going to help somebody avoid a surgery, avoid medications, even the quote unquote benign medications. That's responsible pain management. Hi, it's Dr. Morris with Magnolia Medical Center. Today, we're going to talk about something. This isn't really a health tip here. It's just something that is really, really concerning. And it's something that we really try to do here in Middle Tennessee and in our office is practice responsible pain management. So when people have pain, it is totally expected that they will want to get out of pain. Pain limits what we do in our lives. It can be debilitating. It makes us feel like we can't, I can remember times that I've had pain and you go through this thing in your head like, oh my God, what if this never goes away? What if I'm stuck feeling this way the rest of my life? What if I can't live the life that I want to? So people want to get out of pain, but unfortunately in our country, we don't, that most of modern medicine doesn't do anything responsibly when it comes to medication and medicine, especially regarding pain. So the most common treatment for back pain still to this day, regardless of what you've heard and regardless of what's been in the news, still the most common treatment for back pain today is a prescription pain medication. Usually they're addictive, so an opioid of some sort. And we know how bad the opioid problem is with heroin and fentanyl. Most addicts, a couple of years ago, it may have changed, but a couple of years ago, 80% of the people that were addicted to heroin or fentanyl started their addiction with a prescription pain medication that was prescribed by a doctor. So that's not responsible pain management, is just getting prescribed a medication when there could be other modalities that can help fix the problem. The FDA admits that 12 to 15,000 people a year die from taking ibuprofen, non-steroidal anti-inflammatory medications, Tylenol, aspirin, these things that are supposedly benign. 12 to 15,000 people are dying from that every year. So is that responsible pain management? I would argue that it isn't. In 2017, I think it was, somewhere in the vicinity of 50 plus thousand people died due to overdose related to opioids. Most of them started with a prescription pain medication. Last year, that number was well over 100,000. So in a 4 to 5 year time period, we nearly doubled the number of people that are dying from prescription, that started with prescription opioids and advanced to heroin and fentanyl. That is not responsible pain management. Responsible pain management is also not going, you know what, the first thing we're going to do is cut on somebody, and especially when most of the time, and I know what happens. I talk to patients all the time, and they're like, no, my situation was different. I was not the unnecessary surgery. Mine was the necessary surgery. Folks, if something like 80%, 80 plus percent, I think it's 82% of all surgeries, according to the AMA and doctors that do surgeries, they're considered that 82% of surgeries are considered unnecessary. That means there's an 82% chance that your surgery could have been unnecessary. You might have been able to do something else. Handling pain responsibly. What does that mean? It means practicing and doing modalities that can actually heal the body. Your body was given by God, or whatever you believe in, the ability to heal and repair. And how do you enhance that? That's responsible pain management. Doing things that are going to help somebody avoid a surgery, avoid medications, even the quote unquote benign medications. That's responsible pain management. If you know somebody that's suffering, all right, they're dealing with pain, even if it's minor, I'm begging you, don't let the minor pain go. Pay attention to that now, because minor problems become bigger issues. You know, if my daughter came home from school with a D on her report card, I'm not going to sit there and go, well, she'll do better next time. We're going to have a conversation. We need to address that now before it becomes a bigger problem. I don't need her getting F's because I didn't address it. It's the same way with your health, folks. Pay attention to these problems now so they don't become bigger issues later. If you have a major problem now, don't assume that your only solution is a pill or surgery. Look at a clinic that practices some level of responsible pain management and see if there's something that can be done to help you resolve the problem naturally and get your body to heal. We need to change the healthcare landscape in this country, especially relating to pain. It's an epidemic proportions. The number of people are dying from pain medications, the addictive pain medications, not to mention how many people are dying because they're so sick of the pain and they take their own life. Like, this is not how we should be dealing with these problems. We should be addressing them with solutions that are actual solutions, not things that are just designed to cover up the problem. I know I'm getting a little bit heated here, but there's so many things that we hear patients that are given gabapentin. I talked to a patient yesterday, and he came in and he was taking 3,200 milligrams of ibuprofen a day. At that rate, he can kiss his liver, his kidneys, and his intestines goodbye in a very short period of time. Those organs cannot take that kind of abuse from simple ibuprofen. It's just like we hear these things all the time. We're trying to do something about it. If you are suffering with pain, you have a problem with pain, you're like, man, my back is killing me. I've got this issue. Whatever the words that you're using when you're telling your friends and family about the thing that's going on with you. You're saying, my shoulder's killing me. I've had this thing going on for a while. It's really annoying. If you're dealing with pain, minor, moderate pain, major pain, come in and let us take a look at you. Let us see if there's something that can be done, okay? You can give the office a call. The number at the office is 615-225-9100. Find out if there's something that can be done to keep you out of the pill box and out of the off the surgery table. Folks, I hope you found this helpful. Please share this. This is so important that people do something so that they stop suffering. We don't want people to suffer. We just want to fix the broken healthcare system, and there's a better way to deal with pain. Dr. Morris from Magnolia Medical Center, thanks for watching.